Hi, I'm Dr. Martínez-Vidal. Thank you for your interest in our work, which I'm presenting on behalf of our research group. This study is a retrospective analysis of Biosimilar, the Spanish Multicenter Prospective Observational Registry of patients with rheumatic diseases in biological therapies. In real clinical practice, drug survival is a very important outcome, which can be influenced by different factors related to efficacy, adverse events, or others, as all we know. For this reason, the main objective of this study was to compare the overall and cause-specific drug discontinuations between subcutaneous biosimilar etanercept and adalimumab and their originators in a prospective cohort of patients with rheumatic diseases. All the patients who had started etanercept or adalimumab since biosimilars were available were included for this study. More than 4,700 courses of treatment and more than 4,100 patients. We can see that rheumatoid arthritis was the most frequent condition, and female were up to 60% of the patients. It was a surprise that biosimilars were more frequently prescribed than originators, and they were used quite often as first-line therapy. Originators were discontinued more frequently, and there seemed to be differences regarding the reasons for discontinuation among groups. To identify factors associated with differences in the retention rate, hazard ratios were estimated using adjusted regression models, as we can see here in Table 3. While in these models, the risk of overall discontinuation was indeed lower for biosimilars. Among the factors that increased the risk of discontinuation were the female sex, obesity, and second or subsequent lines of treatment, as one could expect. The use of concomitant methotrexate was associated with a lower risk of discontinuation. But when assessing the cause-specific reasons for discontinuation, such as inefficacy, remission, or adverse events, there were no statistically significant differences in the risk of discontinuation between groups. There are previous data from other European registries in which similar one-year retention rates were found between different originator and biosimilar molecules. Our key point is that we show not only 1 year but long-term survival results. Other strong points in our study are the multi-center nationwide setting, the long-term design, and the large number of patients from daily clinical practice. And also let me highlight that we included a considerable number of patients with juvenile idiopathic arthritis. Together with previous results of equivalency in efficacy and side effects, our data, which show a similar retention rate, suggest that in pediatric patients, either biosimilar or originator subcutaneous TNF inhibitors may be used. In conclusion, in patients with rheumatic diseases, there was no difference in long-term survival due to inefficacy or adverse events between subcutaneous biosimilar or originator TNF inhibitors. In real-world practice, this can be very reassuring when deciding to start a biosimilar. For other details, please see the complete article in Journal of Rheumatology. Thank you.